Jyoti, I couldn't believe it when it happened, but there's a second drug approved, entrectinib, in this basically this same space. And maybe you could give us that big picture about, is it different mechanism, or, in what way, why would you decide one versus the other?
Sure. So certainly, echoing on, I think, felt like we've hit sort of a spate of riches, right? So larotrectinib is so well tolerated. We see patients getting back to function, and we've seen long duration of responses. So when entrectinib was approved, certainly another option for our patients. Entrectinib is a little bit different in that it has activity against a number of kinases. So we know that there's also ROS1 and ALK activity. And so it's been actually approved for both kinases. Entrectinib, the earlier trials were based on a number of sort of basket trials as well as a pediatric study. And the number of patients with CNS metastasis was a little bit higher, so perhaps more data there, particularly for those of us that do lung cancer, in which we see patients with ROS1 disease and translocations who, again, have a proclivity for brain metastasis. That sort of figures into our rubric of putting these drugs together. I would say that the clinical activity profile to me is functionally pretty similar. The total number of patients that we see that have been treated across these trials is very small and limited. Suffice it to say, there are more CNS patients treated with entrectinib, so perhaps a little greater experience there. Toxicity might be a little bit of a different story, a little bit more fatigue with entrectinib, and some weight gain. At least in my experience, patients might have had a little bit harder time with some of these low-grade toxicities. But again, for someone with known CNS metastasis, that may be a way to sort of tease these out. But again, these are small numbers of studies looking at, I think, different pockets of patients, one larger sort of basket as opposed to subgroup analysis of some smaller ones.
Yeah, that's very insightful. Shubham, have you used this drug at all, entrectinib, and is it like equally active across all of the three subtypes?
Yeah, so I think it does, the same thing just as Jyoti said. So it does the entrec 1, 2, and 3, all three genes essentially, ALK and ROS1 for rearrangement. So it's, I think it's fairly similar. Most of my experience has been more with larotrectinib than entrectinib, but I think looking at the data, it seemed to be fairly similar. Just as Jyoti pointed out, with brain metastases and everything, they looked at that. So we have larotrectinib data with brain metastases also. So I think
yeah, that's great.